all CEOs, me included, we don't actually know what we're doing.
They're all sharks, so all you got to do, though, is know shark behavior.
I don't think we've ever talked about this before.
We can capture all of the wallet share.
First place you start is with the product.
That's just the first note.
This is the Capital Stack. Hey, everybody, this is David Paul, the host of the Capital Stack podcast, where I talk to founders, operators, and investors about all things value creation and startups. Not just any startups, but vertical software or niche tech-enabled service plays. And we talk to founders specifically about their relationships with capital and how they build value and how they think about it. Today, I am talking to my neighbor and a friend of mine, Seth Merritt, who is a couple offices down. I generally like to bother him by just poking my head in often. And his daughter watches my kids sometimes, which is cool. But now I am having him here to talk about Welby Health. Seth, how are you?
I am good, David. How are you? And I can attest to the fact that David does come and bother me in my office quite regularly. And some days I appreciate it. Some days I do not appreciate it.
Well, sometimes you just have to suck it up, Seth.
I know, I do. Just for you, David, because I do DWP.
You can't just have the good and not the bad.
It's like a marriage, like,
exactly.
You love me or you hate me.
Exactly. So, tell the audience a little bit about yourself and Welby.
Sure. So I spent most of my career in healthcare, mainly on the payer side, working for health insurance carriers. And a lot of that time was spent doing what we call value-based care. So it is essentially trying to deliver better quality outcomes for patients and for a lower cost. And what we were doing is going into providers and trying to basically convince them to take more of the risk from the health plan perspective to better manage their patient panel, and we would try to help them manage that. And one thing I found in that process is there's not really a ton of innovation going on from the health plan perspective. It's still basically processing the way things were 50 years ago in healthcare. As much as they try to move things along, it doesn't really happen for a lot of different reasons. And I also realized that at the end of the day, we were not really engaging with the clinicians and patients who drive care and outcomes. And we were dealing with a lot of health systems and larger providers and administrative, pieces of the organization versus the individual doctor working in his office and the patient who has hypertension and diabetes. They were just sort of like numbers on a chart. So that encouraged me to go build what became Welby Health. And what Welby Health is now is essentially an outsourced care management program for physician practices to help them manage their patients who do have high risk needs like hypertension, diabetes, congestive heart failure, COPD, things like that require a lot of interventions, not necessarily in the brick and mortar office, but a lot of care coordination and care management. And that's what Welby does through a combination of software, inventions that we've made, but then also providing the appropriate level of clinical staffing for those patients to take the burden off of the primary care doctor to touch these patients who really need a lot of help. So it's very high level what we do, but it is, like you said, a tech-enabled service where it's a combination of clinicians, so like nurses, medical assistants, NPs, things like that, to support the physician practices that we work with, and software that does a lot of automation around patient engagement, outreach, billing, stuff that is, the reason why most physicians don't do this stuff in the first place by themselves, because it does require a lot of, documentation and things that can be automated if you have the technology to be able to do it.
And you worked with Dignity Health, right?
No, from a payer.
No, what payer did you work with?
I worked with Anthem. I worked with Aetna. I worked with CVS in different capacities.
Is that because you got fired a lot, or?
No. Let's see. I started with my first big plan was with Anthem, and I worked there for quite a while. I think I was there for probably 10 years. And I got really super frustrated by working for such a big organization. And I left and went to go work for a startup company that definitely didn't succeed in what we were trying to do. I think it pivoted around and it's still alive, but it was definitely not what I wanted to do. But I felt a lot more innovation happening in like a 5-person company than I did with like this multi-billion-dollar organization. So I left that company and went to go work at Aetna because they actually had a startup arm part of the company, which was great for me because it was kind of like you could have the infrastructure and protection of a big organization and rules and policies and money in the bank and stuff like that. But also like they were trying to be innovative. And then that startup arm ended up getting like rolled into the broader part of the company. And then that Aetna got bought by CVS. And then it was just like another big, massive organization that was not like super compelling to me. And that's when I came to start Welby.
So when you were trying to like roll out value-based care initiatives, was that on the like for the payers Medicare Advantage side, or was that for commercial lines?
It was all of it. So, I mean, it was everything from like P4P incentive programs for the medical groups to building patient-centered medical homes to building ACOs to building ACO products to Medicare Advantage to bundled payments. Like we always thought of it as a continuum of value-based care where the risk and the reward always ended up getting better. So you could start from just a P4P program, pay for performance program where improved quality outcomes will give you a couple dollars per patient per month, all the way up to like, we'll just fully share risk. And then you're responsible for all the financial and clinical outcomes of a panel of patients that are assigned to you. And like the most extreme version of that is like a Kaiser model where they run everything. And it's like, we're the health plan, we're the medical group, we are the customer service claims processing organization, and they just take full everything. There was always a split in the commercial business of like how much the health plan would do versus what the providers would be able to do.
I just think that it's funny that you were tasked to, try to stimulate value-based care arrangements. And all I hear on the provider side is how much they want to be in the value-based care game and participate. But like, it's so difficult because you have to have the data set, or like digital health companies that want to, do stuff on the payer side. But they have to go to consumer first to get the data set. How do you think about it? Is it like, we've been talking about value-based care for the last, 15 years, and we're going to be talking about it for the next 15 years. So
more than that.
What's up?
So I would say that you're a couple of things. I mean, one of the reasons that I did want to work with Welby is the only people we were talking to from a value-based care perspective are people who had really deep pockets that could invest in value-based care to, manage it, right? Like if you don't have a population of 10, 20, 30,000 people, you don't have like a digital infrastructure team, you don't have your own case management department. Like how are you going to take risk for patients? If you're a 5-doctor primary care practice, like you can't really do that. So you're either going to sell the practice to a bigger org, you're going to join an ACO and give up control of your practice, or you're not going to get into value-based care. So this, like our solution for the providers was here, build an infrastructure without having to fully jump into value-based care to like help you get there. Because the other problem is it's not like tomorrow the world's value-based care, so make all your investments to be successful in value-based care. It's like it's so incrementally moving there that you have to run a business in a fee-for-service model while you're
Collecting
preparing to be successful in value-based care. And it's like if you're making 5% margin on your fee-for-service business, how much money do you have to invest in value-based care that's going to trickle in like payer by payer and patient by patient? It's just really hard. So someone said something where it's just like, you have to have solutions that work in both spaces, because if you're a great value-based care solution, the market's too small for you to go do that. And no one is 100% value-based care, or like very little people are. And if you're only building for a fee-for-service business, you're missing the whole boat of like what is actually moving and like where this is going to be in 3 or 5 or 10 years, or where providers are trying to invest their time and resources. So you need something that can do both of those things at the same time, because it is just going to be like a long slog. And just the infrastructure of how it works is like the payers, the providers are trusting payers with their data about how they're performing, to base my incentive and bonus payments on. And providers and payers have never been super close friends. So you're trusting your guy you're negotiating contracts with every 3 years to tell you how you're performing. It's just not an ideal solution to be like, we're totally 100% partners in this. And
and I trust you that you're not gonna, fuck me on this. And we're functioning at maybe cash flow loss, hoping for a bonus at the end that we don't know is going to come.
Yeah, exactly. And you want me to trust you, guy, who's like screwing me over the last 7 times we tried to negotiate a deal over something small, and you want me to invest this money today to hope I get paid back later. That's a hard ask, which was exactly my job. And that was going to be like, no, we've strategically chosen you and this is how we're going to do it. And this is a very specific model. And here's the financial structure about how we're going to go do that. But it's, you can't do that just with every single provider that's out there in the country. And, you got to be pretty picky of who is ready to go do this stuff.
So with it, it's just funny. I mean, it's there's not a silver bullet for it. Everyone complains about healthcare spending, but no one's really putting their money where their mouth is, and trying to do anything about it.
Well, I'll give you a funny example, as maybe it's telling, maybe it's just anecdotal, but this is why I think it's such a problem. So we were building these ACO products to sell into commercial plans who were going into large self-funded employers who were spending millions and millions of dollars a year on healthcare. And we would build these ACO products with integrated providers, way better quality, way better outcomes, and going to the employers and saying, hey, if you use our ACO product, even as an option for your members, for your employees, not even forcing them to go in there, just put it as an option in your benefit plan, and we'll save you 35% on healthcare costs. You would think 100% of the people would do that, right? No downside. I can offer a plan that's 35% cheaper for my employees, and maybe my low wage employees start moving in there and I'll migrate. We had the hardest time selling that into employers for reasons I still don't understand. So if you're complaining about costs, we're giving you a no downside risk option to save 35% on the second biggest line item on your budget, and you don't do it, then you're lying about how aggressive you really need to cut costs and manage it. It's just people aren't that.
Yeah. Do you think?
And I think it's
do you think they just don't believe you?
I think it is you've got HR directors and managers who are I'm going to get calls from my employees because some provider's not in network anymore and they chose the wrong plan, and I just don't want to deal with it. So let's just say no. Which is, if you're the CEO or you're the CFO and this is millions of dollars in savings annually, you're going to say, we're going to do it no matter what. And that's who we would see do it, are people who were in retail or a lot of low wage workers where they've got, 50,000 employees across the country and they're willing to deal with the heat because they're going to turn over anyway. But anyone who, thought of this as there's going to be a pain in my employee base, we're not going to do it. And this was even, during not the greatest time in the economy. So this wasn't boom times of, 2000 or
right.
Whatever.
People felt
this was
they felt the contraction.
Yeah, and they were still not doing it.
So you have bounced around. You've done big company, small company, and then you decide to become a founder yourself. Tell us about that journey and making the plunge.
Yeah, good question. All
the questions I ask are good, Seth.
Amazing question. I just never thought I was an entrepreneur until I became an entrepreneur. And then I realized this is why I was so unhappy with my corporate jobs was I came into the world of getting out of school and was I'm just going to go become a VP or an SVP and be an executive and make a lot of money and be super happy in my corner office and have people under me. And this is going to fulfill my day. And no matter how much I moved in terms of promotion and title and money and all of that stuff, it was I never really got to do anything I wanted to do. I was in meetings, following orders, doing things. And I didn't feel at the end of the day, my life was contributing a ton of stuff other than to, high level corporate shareholder value of people who had no idea what I did on a day-to-day basis. And it was just super frustrating. And I was always under the impression, if you want to be an entrepreneur, you've got to go raise tens of millions of dollars to like start a company and have like everything fully baked and ready to go do something. And I went back to school actually at ASU to do their like technology entrepreneurship program just because I wanted to understand more about it. And I read a book called The $100 Startup. And I don't know if you've ever read that book, but it's pretty interesting. It's like how you can do a startup business with $100. And it was everything as stupid as like, okay, if you think you can do consulting work, go put up a website and say, I'm Seth, I'm a consultant, and, you know, click here if you want to book me. You know, if like you really want to do stuff, you don't have to actually like have all that stuff built. So that just sort of changed my mindset about what a minimum viable product of how you could actually go be an entrepreneur without raising just like ridiculous amounts of money that are like make you fully protected. And I also just started learning a little bit more about how the entrepreneur system and capital system sort of worked. Just got me more interested in it. And as I reflected back in my career, like the times that I was doing stuff innovative, whether it was formally my job or not, or stuff that I just wanted to do on the side for myself, was where I actually like generated my own internal motor of stuff. So from there, I was like, I'm just going to go. Welby actually started as like a school project. So we were like, build a product and see if people will buy it and go talk to customers. So I was really interested in coding. I built a basic patient-facing app. I started talking to patients and they were like, yeah, I would totally use this. I was like, really? It's like this thing I made on my own. Like, okay. So it said there was like some gap in the market. And then I started talking to some doctors and be like, hey, would you pay for this? And like, yeah, I would use this. I don't have anything like this. So I was like, okay, I'll just go see if I can get a customer with this. I got like my first couple of customers. And I remember the first time it was super exciting when I got my first customer, like, oh my God, somebody signed a contract, like they're a customer of this company that I built. And then they paid their first bill. And it was like, I don't even remember, like $300 or something. I was like, oh my God, this guy like literally just paid me $300 for a product that I made that didn't exist, 3 months ago. That's amazing. Like maybe this will work. Right. So I was just doing some stuff like on the side and trying to move things along. And then was like, if I'm going to do this, that sounds so intuitive,
but like for people like that came from corporate America, like that is pretty like ground shifting. Like I'm valuable outside of a corporate structure and I can create something that's innovative and interesting.
Yeah. And I think like, as I think about it, they make it really hard to like get out. Like I'm an older entrepreneur for sure. Like if I started this when I was 22 years old and I was willing to eat ramen noodles, I could have gone a lot further without raising any capital and moving things. But like the older you get and the more burden you have, unless you have like money sitting around or like you're saving this stuff up for the chance you are going to go do an entrepreneur, they make it really hard because their salary gets like really, really high. You've got a lot of expenses. You have a lifestyle you're used to, and to go do that. Yeah, I got a wife. I got a family that's got to watch kids to like pay my bills. It's just harder and harder, which is why you don't really see people who have a lot of like super deep professional experience coming in and like starting companies, because it's a big lift to like go from that to this, which is good and bad. I mean, it's cool that, you're coming in without any preconceived ideas about business and like, I'm going to try this thing because I think it's going to work. But then on the downside, it's like you don't really know what other people have done before, like how the whole business actually works, which is probably why I personally think digital healthcare stuff has seen such I don't even know where it is today, but like it's not typically good. There's a lot of stuff in digital healthcare, lots of money, and not much has sort of like stuck and delivered and moved the needle, because healthcare is such a messed up industry. If you don't really understand who's paying, why, for what, how things get adopted, then you're not going to be very successful unless you do go like the DTC route, which is like very small in healthcare. Because there's not a lot of people who've been in healthcare and understand like all the nuances of like how payers work. Like you said, I'm going to build an app and this is going to save, payers millions and millions of dollars on pre-authorizations because we built an AI tool that like, automates all of that stuff. Your average sales cycle into a payer is like 5 years, so by the time you actually get this in, it's obsolete.
Right.
And like the just decision.
Somebody else did it that raised more money, that had a relationship.
Yeah.
Right.
Exactly.
And there's only so
like,
many payers.
Yeah, there's like 5 payers.
Right.
So it just doesn't necessarily work that way. Or like, hey, here's a great thing that's going to totally improve patient outcomes and they're going to love it and it's going to improve the patient experience and, everything. Like, great, but who's going to pay for it? Like, unless there's a CPT code tied to it, like nobody's paying for this stuff. And like, if you're asking doctors on their 2% margin to go pay for something else, even if it's the best thing ever, it's just not going to happen. So it's frustrating. Like, I wish there were more people who like really fully understood healthcare are getting there. And I feel like some of the stuff that's happening where you've had people be super successful in healthcare startups, exit and start something else. It's like they learned how the stuff works. And on their second iteration of a startup, like they're doing stuff that like fits more into the existing model that can be transformative. So that's kind of interesting and exciting to see.
And so now that you've been in market, you've got, a pretty good size amount of customers and you've raised some money. What was the big learning about like, oh my goodness, somebody's going to actually put money and buy a piece of my company. And now we're going to execute. I mean, that must've been kind of a interesting.
Yeah. I would say like the biggest thing not being around there is just like, it's a very hard sort of ecosystem to penetrate into venture capital and funds and things like that, not being in it. And then like, once you're actually in it, it's like a web of things where now it's like, I get people coming to me looking to like invest in things. Whereas before I was like, who do I even call to like, I had a mentor who's an investor and I'm like, how do I even like talk? Where would I even find investors? Like who do I ask? And like, oh, go like find like people who've invested in other companies that are similar to you, like in the market. And I'm like, where do I even find that? I don't even know. And he like pulls out a list, like he looks at them like, here's 3 people, in San Diego that invest in like healthcare companies. And like, if you're not in the space, like you don't even know that. So I think just like the biggest challenge for me was like finding where to get capital, because nobody tells you any of that stuff unless you're in the mix somewhere. And I've even been involved in little incubators and, things like that. But like, I don't think there's a lot of networking to get in there, which is why, there's so many people in the venture capital space that are outbound looking, like who's out there doing interesting stuff that I can invest in. Because, if you're really early stage, you probably don't have a lot of contacts there to leverage. So that's probably like most jarring thing for me is like learning how that all works. And then I think since then, finding like the right partners, and everybody says it's like, oh, like I want more than money. I want a like real partner to work with. That's great, but it's also just like you really want to find people that you like working with. I didn't really realize like how tied you are to your investors like permanently once you take money. Because it's just like, hey, you're here till this company either sells or implodes, and you're going to be like following this whole way. And that's a rocky road for an entrepreneur and an operator. So having someone who's actually you like talking to, you respect their opinions and, give you good input is actually like pretty valuable, more so than like, hey, does this guy have a big Rolodex of people that he's going to like introduce me to, or, are they very deep in this space and totally understand my market versus is this someone that, when I do have to have a crappy conversation with them about something, like they're going to be like a reasonable person.
I found that to be true from talking to founders that, I've since moved on from and have been bought out. Everyone talks about the proverbial value add, and the ones that actually feel that delivered what was sold. I mean, the only thing contractually that VCs have to do is wire you money, right? I mean, seriously,
which is a low lift, a very low
lift. But I mean, it's risk capital, and there isn't a lot of it compared to the amount of startups that want it. And, there's a cut above, I guess, good startups and bad startups. So the whole value add piece, I think, gets oversold as much as like is this guy a dick? Which is hard to decipher when you're dating.
Yeah. And sometimes, I mean, like, luckily, like, we haven't been in this position, but it's like, sometimes you really need the money. I mean, if you're running out of money and like the only person willing to offer me money is a dick, is it worth it? Like, actually, like, going and working with a dick for the next, forever, like until this thing is over.
Yeah. And sometimes you just need the person that believes in you, right? Even if it is a dick.
That, actually going back to like your first question, that was like the biggest thing for me. So before we took our first investor, which was New Stack Ventures in Chicago,
huge.
They're awesome people. I love Nick. But like I did something called like the New Venture Challenge at Arizona, and like we won this contest and we won $50,000, and it's like nothing. That's like not even a payroll, but it was like, wow, someone actually gave me like an actual real big check with like multiple zeros on it to like go do this thing. Like maybe this idea is actually real. That gave me like a little bit of push. And then when I did take money from New Stack, I was like, man, I went through the whole process. I convinced them of the market and how I'm going to execute and how we're different than anybody else that's doing this stuff. And like these guys look at a million startups and they chose to like put money behind me. I felt a huge amount of like obligation back for that. But then also like really invigorated me of like, yeah, this is actually like a real thing, where before it was kind of my project or whatever. I had a couple of paying customers, but it wasn't something that anybody was like super serious about. And regardless of the money, if I was just doing it on my own and making some money on the side, running it, if I didn't have that push, I probably would have ended up getting bored with it and like folding it down. But it's like, nope, this is the idea. This is what we sold. We're going to go execute on it. And like, I felt that a lot differently after taking money from other people. Yeah.
Well, that's a very like mature, I think, and thoughtful way to think about receiving capital. So you've taken capital in an up market and are now burning capital in a down market from a venture capital perspective, not from like your market perspective, like customer perspective, but just like the availability of capital. So how does that change your relationship with it?
So we did both. We raised money in an up market. So the first time we raised money was the end of 2021. And then we did a follow-on round in 2023. So I've raised in like probably like overly frothy times, and then already in like the terrible times of fundraising. And I think in the beginning of 2023 was probably like one of the worst possible times. I think the change for me was this could actually end at some point, and recognizing like, hey, if we run out of money, there's no guarantee that anybody's going to give us money no matter how much we're doing. And that one of my professors had told me like cash is king and like revenue is not cash. So when you're looking at like your cash, it's like how much cash is actually in the bank, because you could have $1 million in AR, and if you can't make payroll in 2 weeks, like you're out of business. So just being a lot more diligent about like, what are we spending this money on? How do we make sure that like we're getting profit out of this, not wasting money on stuff that's not going to drive value? And then also just balancing how much do we want to invest to grow versus like how much do we want to conserve to see how we can get this into a profitable and sustainable business. And as things have contracted more and there's potential for not raising money, really focusing on like how do we pivot this into like a profitable, sustainable business as like the worst case scenario, and then we can ride it out until it's a better market. And like that's for our business, like that's doable. If I'm still chasing a customer, like maybe that's not doable, but maybe we can't invest all the stuff we want to do on the product side today, but like how do we maintain the cost so that we're covering our basic expenses for the things that we need to do is definitely changed.
What a rational mindset.
Of making, I said, man, I'm old. Like, I'm just like, hey, I have to have a company that like makes money and
more money. Maybe we just get profitable, and wait till the market gets better, as opposed to let's just burn this motherfucker into the ground and see what happens.
And I'm sure someone will come in and give us another like 20 million when we burned the first 10 million,
right.
Which is something I think good for us because like we are a pretty capital efficient business. I'm very cognizant of that and not just burning through money to burn through money, even if it's like, this is the greatest cool feature ever. We had to hire 7 engineers to go build it, but like that doesn't move the needle in terms of like our operating margin or sales or anything. It's just like, what can we do today that generates revenue that's not going to be like super costly? But at the same time too, like when there's less money to be spent on startups, you really have to be differentiated. So how do you show that this is like actually like a valuable, different business in
to an investor or a customer?
To both. I mean, mainly for an investor, though, is what I'm saying. If like they're not deploying as much capital as they used to, they're going to look really hard at like what you're doing. And that has to either be like a profitable business and I see how you're making money with this thing, or I really see the like long-term vision of what you're doing different than anybody else who's in the market. With, I think, the weight being more on like, yeah, I see how you're working. And I feel like right now, at least my view is there's a lot more attention on like steak and less attention on sizzle. It's like, great, this sounds amazing. You're like the best founder ever. You can really spin a story and like you have an amazing deck and like the market looks huge versus like, yeah, you're kind of a fumbly guy and you don't really like speak very well, but like you're making 40% margin and you've grown from like $1 million to $5 million in a year. Like that's more attractive rather than being like, this is going to be the next, Facebook that's going to make me like $1 billion. It's like, no, this is a profitable business. It's going to grow. I see how it can expand. And, I think people pay more attention to that and they'd rather see, yep, you have customers, you have paying customers, you have people who like you have referrals versus, just an amazing idea, an amazing deck.
So you used to make a lot of money. Now you don't make a lot of money.
Yeah. Don't tell my wife that.
Yeah. And now you are in a startup and you're growing and things are good and you are in a good market and you are capital efficient, but like, multiples aren't what they are. So like what stops you from just saying, I could just make a lot of money again. Right. I mean, like, how do you think about stewardship? And because, I found that it's like, if you're talented and you used to make money, right? Like you kind of, and you start to raise, the thing is you haven't raised a lot of money, but let's say you raised 10 or 5 and you only got to X amount of revenue and you're not going to hit your valuation. So you might have to do an extension or raise more capital and the multiple's contracted. So you don't know that you're going to be able to get out, at as much as you want to go in. And do I really want to grind it out for X amount of salary for 3 years just to make this amount of money? Or do I just fold in the towel? How do you think about that? Like every night. Yeah.
every month I make my car payment.
Yeah.
I think about it in a lot of different ways. I mean, my analogy is like, what did like the F-16 fighter pilot do when he retires after, when he's 30 years old and he's got a pension, but he's like used to flying like 500 miles an hour in a like multi-million-dollar jet? That guy going to go be like a consultant somewhere and enjoy his life? I don't think so. He's going to be like, man, I wish I could like get back in that jet. That's sort of how I think about
the startup like company.
To me it is, because it's like I get to do everything.
I love that.
I get
like that's like, and that's how you think about it. I mean, that's phenomenal.
Because like I'm like, what would I do? I'm going to go back and be a VP at a health plan and like make a lot of money and be on conference calls and like go pitch like how our care management team is like so much better than United's care management team. I mean, like I could do that, but I feel like that would be sort of like giving in on some level. And like, I don't want to do that. I would much rather like push everything I can to like make this as successful as possible. And, I also feel like if nothing else, I'm learning a ton in this role that I wouldn't be able to do otherwise. So even if at the end of the day, it doesn't like exit the way I want to exit, I feel like I'll be a way smarter person learning what I learned from this than I would have spending a couple of years doing something else and, be valuable on the back end. The goal is like, go ahead.
What do you know now that you wish you would have known when you first took money?
Yeah. I mean, a lot of things. I don't know what I would change differently, but it's executing on something is a lot different than like what it looks like in a PowerPoint deck for sure. So like when they say like, yep, I'm going to get like X million dollars by this day because we're going to get X customers and this and that and the other thing. And like, you know, no matter what you say, like you're overemphasizing yourself. And, you know, I would get called on that when we were pitching about like, oh, those are like way too rosy. I'm like, no, I just totally see it. Like this is what's going to happen. We're going to X like customers per month. And this is what we're going to do. And like doing it in real life is always way harder. Everything's way slower. Everything's more expensive. The team around you is not what everyone's not doing 50x what they should be doing. Like, you know, you're doing as a CEO.
Or what your expectation is, right?
I'm like, I'm here busting ass all the time. I just think everybody else is. And like, sometimes they are, sometimes they're not, but it's not fair to expect every single person on the team to have as much investment in the company.
Correct.
As like the founder and the CEO does. And it's just always going to be like slower than that. And yeah, so maybe like I would have probably raised, if I knew anything too about like how the markets have changed, I probably would have looked to raise more money when I did the first round, when it was like super frothy, and be like, let's extend this out more. Mm-hmm. But that could have also been downside because I'm like, hey, I got all this free money. Let's go blow it on like A, B, and C. Since I never had a lot of money, I was always like really very diligent about it. And just for like a founder person, it's always way longer. Like you said, I mean, I thought I'd be not as poor as I am in terms of like getting a salary like this far in, which has been like 2 years at this point. But, you know, you got to be prepared in for the long haul. If you're going to do this, it's not going to be like, hey, in 6 or 12 months, you're going to be doing like a Series B and like getting paid like a real person.
Yeah. I feel like just have seen founders, and if you would have had that money, you know, that more money earlier, you would have not have been as far as you are. Because the problem is when you're not in the mode of scarcity, it prolongs you making hard decisions. Like you keep that person, that salesperson on longer than you should, than you should, or you know, stick with the shittier customers. You know, you're just kind of like you're just in a malaise, and you spend more time company building than actually making hard decisions.
Yeah, that's what I was saying. I mean, it'd be nice if I knew what I know now, and I know how important it is to be diligent with cash, but I also took that money. Yeah, that would have been great. Like, or if we like push for like a bigger valuation to like give up less of the company earlier, like that would be great. But I agree. If you just take more money, it's like, okay, well, I got $5 million to spend versus $1 million to spend, and I still want to get the same outcome. I want to get to X, and if I have 5 times as much of it, I'm going to go blow everything. Let's go do more marketing and more stuff before I even like figure out what our real message is, or like who the customer we're actually tackling, or I'm going to go build a 6-person sales team when I don't even know what the product is that we're selling. So we're always like pretty diligent about that stuff, like never having a ton of money.
So what are you excited about over the next 12 months with Welby?
I mean, I'm excited about a lot of things. I mean, I think the biggest piece is I finally feel like our product is in a place where we could sell it to any customer. When we started, like I said, I don't even know if anybody's going to buy this thing. And like, I was really afraid of going to anybody with like any meaningful amount of like patient panel, you know, base. Cause like, I'm like, we're going to screw this up and like not do it very well. And now like, I feel like we've done so much in terms of product development, staff management, hiring, building processes around the clinical pieces, where I do feel like we can just go compete with anybody that's in our space. Obviously, like we don't have the money to really go compete with anybody in the space, but if it's like you want to put me head to head against the biggest competitor in the market, like I feel like we can go do that. And being able to like talk to bigger customers about what like the real value is that we deliver. You know, we've always focused on, hey, these are fee-for-service codes that are going to drive some revenue for you. And, you know, it's a no-risk thing where you're going to generate some cash out of it. And it was a more financial transaction. Now we can start saying, yeah, like look at the quality outcomes we've had and the patient satisfaction scores we're getting. And, you know, being able to work with people who really do care about moving the needle in terms of patient quality. Like that's my biggest thing. And then we've gotten to the point where we can stabilize out like the scale of the business. So again, like we're a tech-enabled service, so we have to manage staff and costs of those people, and how can we scale that up? And that's the biggest thing for a service company, is being able to do that like at scale, and going from 10 to 50 to 500.
Yeah, but you can't charge more for what you do, right? Like the code is the code.
Yeah. Well, we can a little bit where, before we were like, let's be the cheapest in the market. Now it's like, no, we're better than the cheapest in the market. Like we're going to start charging a little bit more than what's in the market because we're delivering a better service to them. But then how do you manage that money too with like making sure that everybody's like being as productive as possible, finding
that's on the rev share side, correct?
The money on the front end, like we'll get a little bit more of the money by charging a little bit more. But then on the cost side, we still have to manage the same nurses and MAs to deal with this like patient population, and making sure that, we're not leaving money on the table. Because if you're not, as productive as you possibly can in this business, then you're not going to, make money.
Yeah, it doesn't make sense to be... You're either going to be the most expensive or the least expensive. It doesn't make sense to be anywhere in the middle.
Yeah. And like we were spending way more than we needed to if we were going to be the least expensive. Like the least expensive people in the market are like literally using offshore people to just like call patients and bother them to take, blood pressure readings. Like I don't want to do that. That's not what our goal is. And that's not what's going to move the needle. And that's not what's going to be a winner. But it's like, hey, if I'm willing to spend for a top tier nurse who's like certified in care management, that's licensed in all 50 states and can like manage your population like 100 times better than you can, why am I not charging like top tier dollars? Even if I'm a small company, like that person's still worth a ton of money.
How long did it take you to come to that realization about charging what you're worth? Is that hard? Because when you're early, right, like you just want to take the money.
Yeah. I got pushed into it from our board, like, why are you not like charging more? And I didn't really have a good answer other than we were trying to keep the revenue split with the doctors, like 50-50. But then it's just, if you think about it, like, why are we giving them 50% of the money? We're doing 100% of the work. Like we should be charging more to them. And I was like, well, let's increment it up by like, 20%. And they're like, no, you need to increment it up like 100%. We met in the middle, but, it's definitely like pushed to be like, you should actually be charging more for what you're doing. And I think that's probably something in my nature, which is I need someone from the outside to tell you like, no, you're actually like more valuable than what you're doing.
Totally. Well, my camera turned off because I haven't got a backup battery, but if you're listening to the pod, it doesn't mean anything. But except for that, you're really missing out on how beautiful Seth is. He's a beautiful middle-aged man in Carlsbad.
I'm still here. You're dismissing, so you're missing out on how beautiful David is.
Right. But if they're just listening and not watching the YouTube.
Oh, then you're just hearing my beautiful silky voice on your stereo.
You kind of sound like a phone sex operator. Do you remember those? Don't act like
that was what I did. That was before I started in healthcare. That was my like college job.
It was like 1-900, right? It wasn't 1-800. It was 1-900. They could bill.
Oh yeah.
Everybody, thank you so much for listening to another episode of the Capital Stack. If you like what you heard, please subscribe, tell a friend. We drop an episode every Tuesday, and we will see you next week. Thank you. Bye-bye.
Thank you for tuning in to the Capital Stack Podcast. Make sure to share this with someone you know that can benefit from this content. Remember to support this show by rating, reviewing, and subscribing. David Paul is the founder and general partner at DWP Capital. All opinions expressed by David and podcast guests are solely their own opinions and do not reflect the opinion of DWP Capital. This podcast is for informational purposes only and should not be relied upon for decisions. David and guests may maintain positions in the securities discussed on this podcast.